Welcome to Nursing Survival. Find me at nursingsurvival.com for nursing-related study guides, as well as a study guide that goes along with this podcast. Today we're going to be discussing beta blockers. They are a cardiac medication. You'll definitely see these on your nursing exams and the NCLEX. Beta blockers work by binding the beta adrenoceptors located in the cardiac tissue and smooth muscles. This blocks the binding of norepinephrine and epinephrine. Beta receptors in the heart cause vasoconstriction and influence the heart to squeeze or contract. When beta blockers attach to the beta adrenoceptors, they stop the normal response of the receptors. They don't stop the beta receptors completely, they just slow them down. Essentially, beta blockers slow down contractility of the heart, which reduces the chance of arrhythmias. This allows the heart to fill with blood, which in turn means the body can receive enough oxygen. Beta blockers also cause vasodilation, which is the widening of blood vessels. Vasodilation results in a decrease in blood pressure. What other influences do beta blockers have on the body? They cause vasodilation, inhibit the sympathetic nervous system, inhibit beta receptors in the heart as well as the body, decrease the heart's ability to contract, and decrease heart rate. They also decrease ventricular afterload, which is the force or pressure the heart has to contract to eject blood during systole. It is largely dependent on aortic pressure. Beta blockers also decrease ventricular irritability, which is a current in the heart or heart tissue that occurs outside the normal conducting system of the heart. There are two classes of beta blockers, selective and non-selective. Selective beta blockers influence beta 1 cells in the body. This slows down the heart rate and has a more focused influence on just the heart. Some examples of selective beta blockers are metoprolol, atenolol, and esmolol. Non-selective beta blockers influence both beta 1 and beta 2 receptors. This results in both the cardiac and respiratory systems being affected. Non-selective beta blockers cause bronchoconstriction, which is the tightening of smooth muscles in the airway. It can cause coughing and shortness of breath. Some examples of non-selective beta blockers are labetalol, propranolol, and carvedilol. A good way to remember the difference between selective and non-selective beta blockers is beta 1 equals the heart, and you have one heart. Beta 2 equals the lungs, and you have two lungs. You should try to remember examples of both. I remember having a question that had the history of a patient that included asthma, and it asked which of their home meds might be contraindicated. To answer this question, you would have had to know the difference between selective and non-selective, as well as which meds were in each class. Many beta blockers end with OLOL. This will help you recognize them. The next section we're going to review is treatment. Beta blockers are used in the treatment of several conditions. The first and probably most common is hypertension. This is due to its ability to lower blood pressure by reducing cardiac output. Cardiac output is the amount of blood being pumped by the heart through the ventricles. They also lower heart rate in part by blocking epinephrine, which is adrenaline. Beta blockers are used in myocardial infarction prevention. This is because they reduce the workload of the heart, reduce arrhythmias, and decrease the oxygen demand of the heart. Angina is chest pain or discomfort that is the result of a lack of blood and oxygen to the heart. Beta blockers reduce the heart rate, reduce contractility, and reduce arterial pressure, which leads to the reduction in work and oxygen demands of the heart. Arrhythmias are irregular or abnormal heart rhythms. Beta blockers decrease sympathetic influences, which control the pacemaker currents of the heart. Essentially, they help block the re-entry mechanisms. Beta blockers are used in the treatment of chronic heart diseases. They are also used to treat non-cardiac issues, including migraines. Beta blockers cause vasodilation in the vessels in the brain. This can help relieve migraines. They are also used to treat glaucoma because they lower intraocular pressure by decreasing fluid production. For treatment, it is important to remember that beta blockers are used in the treatment of cardiac and non-cardiac diseases. If you know how they work in the body, it'll be easier to remember what they can treat. Side effects are very important to know with any medication. Beta blockers can cause bradycardia, which is a heart rate less than 60 beats per minute. They can also cause orthostatic hypotension, which is the blood pressure dropping when standing, nausea, vomiting, diarrhea, insomnia, asthma and other respiratory issues, hypoglycemia, headaches, and fatigue and weakness. Key side effects to remember are bradycardia, hypotension, and hypoglycemia. You may encounter a question regarding diabetic patients and beta blockers. Respiratory issues are commonly seen on tests as well. Remember, non-selective beta blockers affect beta 1 and beta 2 receptors and can cause bronchoconstriction. Beta blockers may have interactions with other medications. This includes NSAIDs, as they can cause an increase in blood pressure. Diltiazem, which is a calcium channel blocker, can cause hypotension when taken with beta blockers. Hypotension is normally defined as a blood pressure less than 90/60. Bupropion, also called Wellbutrin, is an antidepressant. When taken with beta blockers, bradycardia and severe hypotension can occur. Fish oil may enhance hypotensive effects. Grape juice and orange juice reduce the bioavailability of the beta blockers. Bioavailability is the amount of drug that is absorbed. Penicillin can cause anaphylactic shock. Nursing considerations for beta blockers include checking the patient's heart rate before administering. Since they cause bradycardia, you want to hold if their heart rate is less than 60 beats per minute. You would also want to check the patient's blood pressure before giving and hold if the patient was hypotensive, a blood pressure less than 90/60. Another nursing consideration is using caution with patients who are diabetic. Beta blockers can mask the signs and symptoms of hypoglycemia, which is low blood sugar. You would want to check the blood glucose in patients with a history of diabetes. Also remember that non-selective beta blockers affects the lungs, so a patient with respiratory issues should consider a different treatment or may need additional monitoring. Labs to consider when administering are electrolytes, BUN, and creatinine. Knowing lab values is critical for NCLEX and nursing exams. Patient education is always important with any medication. Some examples include instructing the patient to not stop taking the beta blockers abruptly. This may cause a rebound in hypertension. Tell the patient to talk to their doctor before stopping and to taper slowly. Instruct the patient to get up from bed or a chair slowly due to orthostatic hypotension. If your patient is taking metoprolol, inform them to take it with meals. They should avoid drinking alcohol due to the enhanced depressive effects. Beta blockers are contraindicated in patients with several conditions. This includes patients with renal failure, peripheral vascular disease, or a history of Raynaud's phenomenon. Raynaud's phenomenon is a reduction in blood flow that is typically seen in the fingers and toes. Patients with respiratory issues such as asthma or COPD should not take non-selective beta blockers. This can cause bronchospasms. Patients with bradyarrhythmias and partial AV blocks should also not take beta blockers. Again, respiratory issues are a key point with beta blockers, but you should know that other conditions are contraindicated as well. Thank you for listening to this episode of Nursing Survival. Find me at nursingsurvival.com for study guides that go along with this podcast, as well as other nursing topics. I also have fill-in-the-blank and coloring pages, so you can listen and stay engaged. I'd love to hear from you. Contact me with any topics you'd like to hear. Sign up for my emails so you can find out when I'm having special promotions and giveaways. Thank you.